So this video is to demonstrate how to tape an ankle. So when you do your pre-wrap, you'll go around the lower leg, and then you'll complete some figure eights around the foot. The first component of the tape job is
applying a top anchor and a bottom anchor,
which should go along the medial aspect of the foot first, and then finish up on the lateral side of the foot. So again, just remember to start on the top. You would come along the medial aspect of the foot, which is a little easier to allow the tape to not wrinkle. So that's the first step, a top and a bottom anchor. So the next step would be to complete a stirrup. For a lateral ankle sprain, which brings the foot into inversion, we would start the stirrup on the medial aspect of the leg. And so we would start the first stirrup on the anchor, and we want the stirrup to transition down the leg and end up on the most posterior portion of the heel. We don't want the stirrup to come too far to where it transitions back behind the leg and off of the heel. We don't want that. We want to have the stirrup transition again down the posterior aspect of the leg where there's no wrinkles, and end up on as far back on the heel as possible before it starts to come off the heel. So that's the beginning of the first stirrup. As we transition onto the lateral aspect of the leg to finish the first stirrup, we're going to again roll the tape up toward the leg and allow it to fall on the most posterior portion of the leg, again, in line with the medial aspect of the stirrup. We want to make sure that their foot stays in a dorsiflex position, which this is plantar flexion. We want to make sure it stays dorsiflexed. And then we also will rub the tape in so it adheres to the skin. The finished portion of the first stirrup should end up on the first top anchor. So if it goes a little bit too far, that's okay. We can fix that later, or you could actually just cut the tape. Now it finishes directly on the top anchor. The next portion of the tape job is a cover strip. The cover strip starts on the most inferior portion of the lower leg before the lower leg transitions to the foot. So I'll place the tape right on the front of the ankle. If the tape starts too low, then the tape will not circle around the lower leg as we'd like it to, nice and clean. So what we want to make sure we do is when we put the tape on, that the tape is on the most inferior or lower portion of the leg before the foot begins. So we go one cover strip, and then we cut it. Now we begin a second stirrup. As the foot stays dorsiflexed to minimize wrinkles and to allow the tape job to be completed effectively, we place the second stirrup half on and half off the first stirrup. So it should overlap by about 50%. We'll rub it in. transition it under the foot, and again, up the lateral aspect of the leg, half on, half off of the lateral aspect of the first stirrup. The next component of the tape job is a second cover strip. And the second cover strip will start half on and half off the first cover strip. And we'll travel around the ankle just like the first cover strip did. The third stirrup will start half on and half off the second stirrup. Come around underneath the heel, 50% on, 50% off the second stirrup, and we'll cover the lateral aspect of the second stirrup. Again, 50% on, 50% off the second stirrup. All while maintaining dorsiflexion of the ankle. And we'll rub all the stirrups in, make it nice and tight. It helps secure the tape job, which allows the tape job to be more effective. And the last part of this component of the tape job is the third cover strip. After you complete the second cover strip, you should have a space showing pre-wrap, which the third cover strip will cover. And the third cover strip will cover this open space, comes around the leg again, and will complete what I consider to be the base or the foundation of the ankle tape procedure.